We'll start from the top, which is N. Why, I don't know. But N is your pressure manometer. So that's how you would know how much pressure is being used to push the breath into the patient. B is your sensitivity knob. This is what you turn on to go into which mode?
Assist control.
Why? What happens if it's off?
The patient cannot
That's for
trigger
this
breath.
control mode where the patient can initiate it.
If the
They'll block
patient
that.
awakes, they won't be able to breathe. They'll fight against the machine.
Or rip the tube out.
Under that is flow. So your peak flow knob, and that's liters per minute. Below B and C is A. On and off switch. Simple enough, just like a light.
I know that.
Across from it is D. That's your rate. So how many breaths per minute you have the machine set to give the patient. It will give at least that many breaths no matter what. Above that is E, your normal volume, tidal volume. It's in milliliters. And I didn't tell y'all when y'all are doing calculations, all calculations have to be calculated in liters.
But the gauge is in milliliters?
Gauge is in milliliters.
I realize it's an old event.
The
The reason we're making you calculate in liters because the rest of your events are all going to be in liters. It's just MA1 that's...
So calculate in liters, chart in liters. Above that is your normal pressure limit. It's an alarm. So that's F. It goes off when the pressure is too high. J is your manual button. This button allows you to give the patient either a normal extra breath or a sigh extra breath. And sighs, y'all know what a sigh is. We all doing big deep breath and then you exhale.
J is what?
It's your manual buttons. So there's two of them, a normal and a sigh. I is your size settings. So you would set your number of sighs per hour and how many sighs. So if you set the machine to give them 6 sighs per hour, it will give a sigh how often?
10 seconds.
Hour.
10 minutes.
So if you set it at 6 per hour, and then you set it at 2, for how many? Every 10 minutes it will give the patient 2 sighs. Make sense? Sigh volume, tidal volume. It's another setting. This is how much volume is the patient's getting during a sigh breath. You set that either using 1.5 or 2 times the normal tidal volume that you set. So if you set the normal tidal volume at 500, your sigh tidal volume should be
1,000.
You use 1,000. So you can multiply by 1.5 or 2. 2 is easier. Sigh pressure limit, that's also an alarm. That would be how high the pressure could go to before the vent lets you know during a sigh. That's G. K is your O2%. Goes from 21 to 100%. L is expiratory resistance. don't touch it. You don't need to know it. Just right, don't touch it. And below that is M. That's your nebulizer. So this machine has the ability to give a nebulized treatment through the machine. And if you were to do that, it would connect here on the side. There's a little outlet that says nebulizer. Then across the top are your alarms and buttons. So O would be your assist light. It will come on when the patient has triggered a breath. So it lets you know your patient's triggered a breath and that's one of their breaths. It's not just a normal timed machine breath. P is your pressure alarm light. It goes off when either the normal pressure limit has been reached or the side pressure limit has been reached. Q is your ratio light. It will go off when you have an inverse ratio. Inverse ratio would mean that the patient has longer to inhale than to exhale. We don't breathe like that. It's not normal. The only time you really see it is during ARDS, patient with ARDS. So if you see that, then you need to shorten your inspiratory time, and you would do that, y'all know how?
No.
Just from previous knowledge, think about it. You need to shorten your inspiratory time. So what controls how fast or slow that breath
Right.
is going in?
Ease on the pressure.
No.
Expiration.
Fast or slow? A breath is a flow. Peak flow.
I done missed the whole one. So you said this is
Peak
for
flow controls how fast or slow your patient's breath is going in. If you increase peak flow, then your inspiration is going to go in faster and you will have more time to exhale. Right?
we didn't
Makes
do
sense?
that. It makes sense.
Yeah,
It makes sense.